So let's say you present to the office and you have a diagnosis of hip arthritis. Hip arthritis is very similar to knee arthritis. It's a wear and tear of the articular cartilage inside the hip joint. We start conservatively. We do physical therapy. We can do corticosteroid injections, which is a strong anti-inflammatory. Again, it goes inside the hip joint, calm the inflammation down, and then that usually provides relief. Therapy helps by strengthening the muscles around the core and the hips. A lot of times getting this strong helps with the pain. None of the stuff that we do with regards to treatment options besides surgery reverses the arthritis or it changes it. It addresses the pain associated with it. If you do that and you're still having pain and it's significant, then you'd have surgery or you'd be a candidate for surgery, which would be a total hip arthroplasty. A total hip arthroplasty is you're replacing the hip joint. So the socket and the ball, where it's worn out, it's replaced with metal and plastic. The idea is to relieve the pain that's associated with arthritis. So it's a hip replacement. There are different approaches. There's different ways that you can do a hip replacement. It's a matter of whether you want to come from the front, the side, or the back. The idea is that you get to the joint from different ways to replace it. Benefits of different approaches. With an anterior approach, the incision is in the front. Initially, it could be a quicker recovery within the first couple of weeks. Studies have shown that long term, it doesn't make a difference, whether it's a posterior approach versus an anterior approach. So talk with your surgeon. If that's an issue, discuss the different options and then see what the recommendations are. There are risks with a hip replacement. Anytime you have a hip replacement, there's a chance for leg length discrepancy, meaning because the hip is being cut and taken out, and we're replacing it with metal and plastic, we're trying to match the anatomy. And anytime we do that, the leg can either turn out to be shorter or longer. So that's one of the potential issues that can happen with a hip replacement. Another potential issue is hip instability or dislocation. The hip can pop out of socket after surgery. Obviously, that's not something you want to have. You typically have to go to the emergency room to get that put back in place to go back in. If this is a recurring problem, then you would have to have revision surgery to try and address the reason for the instability. Another potential issue besides that is you can have complications with infections. If that happens, potentially repeat surgery, antibiotics, etc. And another issue is if you have a fall, you can break around the implant. You can have breaks that happen during surgery that can limit the weight bearing that you have after surgery. So those are the risks that are associated with the procedure. There's also risk of nerve and vessel injury. There's also the risk for blood clots. So you'll typically be started on an anticoagulant or a blood thinner after surgery for approximately 6 weeks. So talk with your surgeon. If you failed non-operative management, this would be a surgical treatment option for hip arthritis.